Today, as there often is, there was a great example of medical stupidity that characterizes medical professionals. It's really amazing that we call certain people medical professionals given that they are anything but professionals at this topic. For example, today, I had a person, I don't want to specify what person, just for liability reasons, but I had a medical person speak about ACE inhibitors. And, yeah. And he talked about how they are like the number one go-to that they should be the number one go-to medication for people with hypertension because they have a complete lack of side effects and something else. Complete lack of side effects. So I go, but I know two people that got kidney damage from them. And he goes, oh, well, yes, if you have atherosclerosis, then they cause kidney damage and can cause kidney failure. But I thought these should be the number one go-to medication for everyone with high blood pressure because they have a complete lack of side effects. Actually, he also talked about how they're kidney protective. How do you reckon those two things together? Complete lack of side effects and kidney protective with, oh, but if you have atherosclerosis, they damage your kidneys and can even give you kidney failure. And let's think for a moment. What kind of people generally need to take high blood pressure medications? Generally people with atherosclerosis. You don't have a lot of perfectly healthy people taking high blood pressure medications. Unless they're bodybuilders, of course. But that's kind of a different thing. We're talking about general medicine here for normal purposes. Generally, if someone needs to take high blood pressure medications, they're also going to have atherosclerosis. And what a coincidence that if you have atherosclerosis, these otherwise harmless medications that have a complete lack of side effects damage and can ruin your kidneys. Yeah, that's just a little catch. They're completely harmless. Unless you have atherosclerosis, which you probably do if you're taking it. So this is a great example of why you really can't trust people who work as doctors that are looked at as medical professionals because they are anything but medical professionals most of the time. While I'm on this topic, I may as well mention, because I saw a certain person again today, who was telling me how gynecomastia is in fact not due to estrogen. Estrogen does not cause gynecomastia. It's only prolactin that causes it. And even in an international meeting of endocrinologists, they discussed how it's actually prolactin that causes gynecomastia in men. It's not estrogen. Only catch there is it's complete and utter nonsense because anyone who has had altered hormonal levels, such as a bodybuilder, could tell you that high estrogen causes gynecomastia. You lower the estrogen, it stops. It's not the prolactin, it's the estrogen. Prolactin can make it worse, but it's the estrogen. So how these experts, these medical professionals, can spout such nonsense, I don't know. But the scary thing is that people go to them and trust them. I've had a medical professional say that ketamine is an ideal anesthetic for pregnant women because it doesn't cross the placental barrier. So it completely doesn't go to the baby. The only problem there is it's complete nonsense. It crosses it immediately. And in fact, studies have shown that it reaches a higher concentration in the baby than in the mother. I'm not saying it's the end of the world to give your baby a little bit of ketamine, but I'd rather not. And if I went to a doctor and that doctor tells me, oh yeah, don't worry about it because it won't go to your baby at all, and then I find out, oh, it actually goes to the baby even more than to my wife, I'd be pretty pissed. Like, why the hell did you tell me that? Like, did you just say this because you felt like saying it? That's the problem. A lot of people, they just say things. They don't know what they're talking about. They just say something. I have a big problem with this. I think I haven't posted this video, but it's like some classmates of mine. They will insist that we never learned a certain topic. And I'll tell them, yes, we did. And they'll go, no, we all agree that we never learned it. It's like, you guys don't know what you're talking about. You just decided to say that. Because in reality, we did learn it. I remember, and I have evidence. And they argue with me. It's like, why the hell are you arguing with me when you don't know what the hell you're talking about? Or for medical things. I've had lots of people argue with me about medical things, just things in general. Don't argue if you don't know. It's like I do MMA lessons. I had been paying for 7 lessons at a time, and I didn't always keep track of them. And sometimes my coach said, now it's done, and I thought, oh, I thought I had 1 more lesson left. Am I going to argue with him? No. Why not? You might wonder, why? Why don't I argue with him that I think I have 1 more left? Keyword, I think. I don't know. I'm not going to argue something that I don't know. It's stupid. It's my fault. If I do actually have 1 lesson left, it's my fault for not knowing. It's my fault for only thinking. If I just think, I'm not going to argue because I don't know if I'm right. If you don't know that you're right, don't argue. It's such idiocy. It's so common nowadays. Especially with people who think they're educated. It's common with everybody, but it's the most harmful with people who think that they are educated. For example, doctors. They go to, or as I like to say, people who work as doctors, because they're not really doctors, they're just people who work as doctors. They went to medical school, they spent an hour or 2 per topic, so you know they're real, true experts on all this stuff. Yeah, they might have spent like a whole 10 hours of their life studying blood pressure. You know, maybe they've spent a whole 20 hours of their life studying blood pressure. Maybe they've spent 30 hours. That's probably like the very highest number of hours that any person who works as a doctor has spent studying blood pressure. Now, there is going to be that 0.001% of people that have a great interest in blood pressure who spend more time studying it. But 99 point something percent of people who work as doctors will have spent hours, like less than 10 hours in their whole life, probably, studying blood pressure. Yet they will talk to you about blood pressure and prescribe you medications as if they know what they're talking about. Oh, well, angiotensin enzyme blockers, they're completely safe and they'll lower your blood pressure and it should be used for everybody. Oh, really? You know that? How do you know that? Somebody told you that? Oh, and you just took their word for it? Yeah, they did. Oh, you read that in a book? Oh, and you just went along with it? Because, you know, every book you read is completely 100% correct. Newsflash, they're not. You can even pick up different medical books that are both accredited books. Accredited. That will say completely different things. Because people write books and they don't know what the hell they're talking about. It's just like these experts go to their conferences and they discuss nonsense. I'd be so rich if I had a little bit of money for every time I heard a medical expert tell me something that I know, I don't think, but I know to be patently false. And it's amazing how many times they'll argue with me. And I know they're not arguing from a point of knowing, because they wouldn't be arguing, because you cannot know it to be what it isn't. I know from experience, and they argue based on some theory or something they read in a book, or something someone told them. It's just ridiculous. I hope you will think about that. I hope you will not argue with people about things you don't know. Before you ever argue about anything, think, do I know that? Like, do I really know that? And you go, well, so-and-so told me. Okay, you don't know it. You should probably just say, well, so-and-so told me. Oh, you read it in a book? Well, maybe you should just say, oh, I read in a book that. But don't argue about it. Don't argue as if you know, because you don't know. Have you actually seen that to be the case? Say it's a medication with side effects. Have you actually given that medication to people and know that there's no side effects? And you may go, if you're working as a doctor, oh yeah, I've prescribed it to lots of people. How well are you monitoring those people? Just because you've prescribed it to people and they don't tell you they're having side effects doesn't mean they're not having side effects. I know people that went to doctors for a long time. They think they're not having any side effects. Doctor thinks they're not having any side effects. One day they do a certain test and go, oops, you're like about to die because your kidneys are in stage 4 kidney failure. But the day before, the doctor thought his treatment was completely side effect free. The patient thought the treatment was completely side effect free. It's because you don't actually know. Make sure you know things. It's a certain scientific mindset that a lot of people lack. They don't realize what they know and what they don't know. And it sounds like something very simple, like realize what you know, realize what you don't know. But this is something that, I mean, there's other things that are major lacking things amongst medical and scientific people, but this is one of the top things. People don't know what they know and what they don't know. I hope you like this video. I hope it helps you. I hope it helps you not to be fooled by people. I'm not saying because they're trying to fool you. Maybe they're trying, maybe they're just stupid or ignorant. But one way or another, I hope you don't fall for something somebody tries to convince you of that they don't actually know. And I hope you don't convince someone else of something that you don't actually know. Because the world's just a better place when people don't convince other people of things that aren't true. Please like, subscribe, and comment. It costs you nothing. Maybe you can help me out someday. Check out my other videos. Maybe you'll like them. Leave a comment.